Good morning, Mr. Chair, Commissioners. I handed out the numbers, and I did put the cases of Clay County on the bottom, so hopefully that you can see the trends from the last 4 weeks. So you look at the number of cases that we have. So 4 weeks ago we were at 69 cases. We're now at 246. Those that no longer need isolation, so those that have come up from the facilities that they were either ill or they've been isolated for the number of days required. And then the number of deaths, 17. Those, the majority of those, if not all, are from our long-term care facilities. So, we continue to increase our cases, but the testing continues to increase both on the North Dakota side and the Minnesota side. And then the other side I just listed, we gave you the cumulative Cass County cases. That's the darkened one, because that's important to note in our metro area that those cases continue to rise. Cass County has 821 cases now, so they've got a significant increase in their cases. 1,518 statewide, so you see the majority of those are in Cass County. And they also have 27 deaths. So based on the information as it's trending up, both in Cass County and Clay County has a number of facilities with quite a few cases, the North Dakota governor requested that we have a Red River Valley COVID task force. So he invited Clay County Public Health to be a part of that because we are part of that metro area. So we have had a couple of meetings in looking at the what the strategy is really looking at long-term care and assisted living facilities, and how we're going to work out testing for all of the residents and the staff. So that's what this task force is looking at right now. Now, we're still working with 2 states, so we're having to work out the logistics of that. But so some of the testing is going to be started on the North Dakota side, and it's going to be, the testing is like a point-in-time testing. So every time you do a test, it's just that specific date and time, whether the individual is positive or negative. And we certainly know that they can develop a positive test even a week later. So that just gives you a point-in-time testing. We're also looking at repeated testing at various intervals, depending on what's happening in those facilities. We would be also monitoring, are they using their personal protective equipment effectively? Are they providing the isolation and quarantine that's necessary? Are they doing the correct cleaning process? So besides just the testing, we're looking at all of the aspects of what they're doing with these COVID cases. We also have a subgroup from this Red River Valley Task Force group. So we've developed a subgroup specifically for Minnesota. So we have, we just had our first meeting yesterday. So it was Clay County Public Health, Minnesota Department of Health, North Dakota Department of Health, a member of the North Dakota Governor's task force person, and then Mayor Judd was on that first initial meeting yesterday. So we are also looking at what are the strategies that Minnesota Department of Health has for the testing of our facilities in Clay County. And so the Minnesota Department of Health has not operationalized their process and strategies yet, but we're working on that, and that should be very soon, so we can address some of the needs for our long-term care facilities as far as getting them tested. So residents and the staff. So that should happen very quickly. The governors, both Minnesota and North Dakota, want this to be simultaneously. That's the most effective, of course, if we can work at the same speed in getting all of this done on the North Dakota side and the Minnesota side. So we're really entrenched in these groups to make that happen. Clay County Public Health is also on a third task force group, so we have a number of task force going on, and that discussion is again with MDH. It's a smaller group of counties. They've asked us to be one of those in looking at what is going on with our long-term care facilities, what has been our role in all of our counties, how can MDH serve that better, how can we work together, what changes do we need to make, and that just started yesterday. So we're on a number of meetings and task force groups that will hopefully move us forward very quickly. So any questions on those new groups that we're working on? And
well, you're going to be
the
focusing
missions?
more on long-term care facilities?
Right.
Is that going to be more of a focus by this committee? Or?
That's correct. Especially the Red River Valley Task Force and the other ones too. Clearly, we need to make some headway in our long-term care, our assisted living, and our corporate care. Those are the vulnerable areas that are being affected pretty significantly.
The Cass and Clay statistics, are they pretty much the same as far as long-term care? I mean, is it about 80% either way? Or
you know, I haven't studied the Cass County statistics, but their numbers are high also in facilities, and they really are the highest in the whole state of North Dakota. So we really need to have a focused strategy on those facilities to make some headway in the spread.
So what's holding up us is that we don't just go in and do that, or can't we just go do it, or do you have enough testing equipment to do it? Or?
Well, part of it was the testing equipment. Part of it was to get who's going to provide the testing, and facilities can provide their own testing if they have the nurses that can do that. And then where do the test results go? And it's not just the testing piece, but all the education that goes along with it. And then when you test staff, you might find additional positive asymptomatic staff. So how are you going to staff it when you have 10 people now that have to be removed from that workforce? So they also have to have a plan for how are we going to staff it when we find all of these positive cases. And then if we have positive residents, do we have the space that we can put them in a quarantine section or isolation section? So they have to have all of those logistics figured out. So it's not just simply to go in and do the testing. So there's lots of planning that has to occur with that. So we're ramping up, and I see that this is going to be kind of at warp speed. So we're trying to stay in step.
I hear in the news this morning that there's a few of them that are refusing to let them be tested. Is that an option, do you think? That some of the nursing homes or long-term care facilities will not allow them to come in to test?
You know, I haven't heard that specifically in our region, so I'm not sure.
I heard the same thing. It was North Dakota. I think there was a couple of them in Minot or something.
Okay, could be. So it just gives a point in time for the first test, and then to determine, do we need to keep doing testing? Because it only gives that point in time. So how will the testing strategy be for repeated testing along the way? So there's lots of work for the task force to do, but it's a good effort, and I think it's a good strategy to look at the vulnerable populations.
Okay.
So, and I'll have Cheryl and Jamie talk a little bit about the work that we're continuing to do.
So first of all, Cheryl and I are going to talk about what we are doing to support long-term care in congregate settings, and it is what we're spending a lot of time on, but I do want to point out that we have over 20 providers serving, thousands of individuals in our community, and they have been closely following the CDC and MDH guidelines from the very beginning. They've been doing staff training, they've been doing staff monitoring, they've been limiting visitors, so they've done a great job of supporting and protecting most of the residents that they serve. The challenges they have been faced with have been related to community spread. The fact that we now know that when a person can be asymptomatic and still spreading that disease. So that's what's giving them the challenge. And then the PPE shortage. And so those are things that they had no control over, but they had plans for how once they had an ill person, they were going to separate them. So they've really done an awesome job, and most of them have been very successful in protecting the citizens. So I really want to point that out. But also, because of those challenges, early on, our incident management team made it a priority that we need to do what we could to support them. So we worked on identifying staff within our agency that have relationships with the long-term care facilities, and we asked them to do a daily reach out, which we kind of thought might be a little bit of harassment, but we found from the providers that it was not. That when you are so busy, that having someone reach out to you every day to say, hey, what's going on today, what can we help you with, we've received a lot of support. So that's what our staff are doing, and it's been very effective in terms of getting them the support that they need. Cheryl's going to talk a little bit about how she's been busy with the long-term care liaisons that we've assigned to those positions and helping them to reach out and access the resources.
Good morning. As Jamie alluded to, we have a couple of nurses that are serving as liaisons with our long-term care facilities, congregate care, which means skilled nursing, assisted living, our corporate adult foster care homes, which is quite a large number of facilities in Clay County. And so they are asking them the various questions through a survey that we developed early on about 5 or 6 weeks ago. And then I get those reports electronically, and they will also communicate with me or the facility itself, because I have built a relationship with some of the nurses in these facilities too. If they are experiencing more positive cases, that they are running low on the personal protective equipment, the PPE, and that I'm able to get that to them through the benefit of our Clay County Emergency Manager, Gabe Tweeten, and also through our West Central Healthcare Coalition, Sean Stowen, was able to provide us with a large number of PPE products that we have in our Clay County Emergency Preparedness Trailer on campus. So that way, if I have a facility that calls later in the day, I have a key to get into that trailer, I can get them the supply that they need and get that to them. But along with just handing over the supplies, early on, start having the conversation of how they're using it properly, especially with adult corporate foster care. They don't always have to deal with these types of situations. We're a skilled nursing home. They have many residents and to care for, so they're a little bit more in tune with the infection control piece of it. So we're doing a lot of education with that, referring them to the MDH and the CDC website of how to basically put on the PPE and to take it off properly without cross-contaminating. We've also had to do the education piece of how to reuse some of these things, especially the face shields that can be wiped off, or even surgical masks. As long as they are not soiled, they can use them for an entire shift. So there's been a lot of education that's gone into this, and I think it's only strengthened our relationships with all of those providers as well.
Good. Okay.
Just have a question, kind of follow up on the conversations that we continue to have in the press conferences. There's been a lot of conversation about counties that are frustrated in their lack of ability to either do contract tracing or help assist Minnesota Department of Health. And there's a pretty substantial article in Minnesota Public News about that as well. And so as part of your subcommittees, are you continuing to voice that concern from this side of the state?
Yes, that's on an ongoing basis. We continually have daily meetings, so we are in contact with the Minnesota Department of Health in their rollout of that contact tracing. Now, I have 2 individuals, Cheryl is one of them, that started the training. So they offered a remote training initially, and it's just the first of a series of trainings. So, and that is a train the trainer. So once Cheryl and the other individual has the complete training and the shadowing, then they can train others. So that's a good start, and that's kind of where we're at with that.
Thanks.
Mr. Chairman?
Go ahead.
Kathy, we've talked about the importance of contact tracing, I think, but before we get to that, the testing that goes on, all the testing for residents of Clay County is now handled either through Sanford or Essentia. And it's my understanding that all test results for Sanford still have to go to the mail. Is that correct?
Either They send them to Mayo, or they send them to their Sioux Falls
Okay.
lab.
So anyway, they have to ship them out, and of course, then there's a delay, and, you know, to me, that also can have an impact on how good contact tracing is. Because if you get a test and you don't know, you know, I'd like to see results in hours rather than days. That would make the contact tracing more effective. But I was talking to somebody, and I think Sanford is close to being able to do their own. Have you heard anything about that?
I think they are close to that.
Okay.
Providing some of that test results in their own lab.
Okay. Including the antibody one, which is also good to know.
Yes, both Sanford and Essentia are working on that antibody testing, and there will be criteria for that as well. So they'll develop, it won't be that initially that everyone can get that.
Okay. Well, keep doing your good work.
So they're in response to your delays, there is delays on the North Dakota side for the testing. There's also delays on the Minnesota side. And
Right.
We've heard from the North Dakota folks as well. They're, you know, that delay of 2 to 3 days
I,
can be a little bit difficult.
you know, I think it's, you know, there's the message to give out there, the importance of the testing, and of course, the more testing you have, the more positive results you're gonna have, and so, you know, I don't think people should panic over that, you know, when they see that, because it's just more people now being tested that were before, but, you know, I think anything that we can do to encourage the ability to do rapid testing as well as rapid contact tracing, which we've already said we would even take over if we had to here in Clay
Right.
County. And our board is ready to do that, you know. But that's only as good as how long it takes to get the results to do. But by the time we get them, that individual who is asymptomatic might have been around 1,000 people.
Right. We wish all the testing was their 90-minute or less
Right.
testing. They have some of the testing that is very rapid, but again, for hospitalized patients or
It's, so just one more question. So the congregate care places are really hit harder in this area. And we talked about that before. We all, you know, you see, you know, in the Fargo-Moorhead area, there are many places that have massive amount of people living under one roof. You know, so, and you don't see that happening there. So that indicates to me that it has to do with the professional services going in.
correct.
And I think you had talked about, right? And that's where it's being spread. And unfortunately, they have to have the care.
Correct.
Okay.
And of course, there's workers that work in possibly more than one facility.
Sure, yeah.
And they're working part-time in some of our facilities here. They're working part-time maybe over in the North Dakota's facilities. So they're aware that, you know, there's the crossover with workers and even with our healthcare workers. So it's a challenge, especially with asymptomatic, so they're not feeling ill. They're still wearing their personal protective equipment, but it's a challenge to keep those numbers down and not do the spread. So,
Well, we need to have them. You have to have them.
yeah, that's right.
Kathy, do you have any idea how many tests in Clay County are happening on a daily basis?
I do not know how many tests are happening, fortunately, because of the majority of the testing being done in Fargo, so we don't get a breakdown of how many tests are being done.
So I guess maybe my question could look at the Fargo-Moorhead region as a whole though, but I would be curious to see, since we hear so much about increased testing, what the percentage of positive for the quantity of tests a week ago versus now is. It would be helpful as we weigh what opening looks like going forward to know that if it really is slowing down. You know, I saw over the weekend our numbers did slow down a little bit. We're still seeing at least a death a day, which is really sad. But
right? And to determine the number of testing for Clay County is a challenge. Minnesota puts out the number of testing, but again, we know that most of our residents are testing over on the Fargo side, so it's a challenge to get those tweaked out just for Clay County testing. So, but I'll ask the questions on our next call about that.
Okay, anybody else got some questions? Okay.
Okay, thank
Cheryl,
you.
Thank you.
Kathy, Jamie, thank you.